Hi there. My name is Marie Swart, and I am a second-year medical student at UW Spokane. Welcome to my poster presentation. So, over the summer, I worked at a family practice clinic in Deer Park, Washington, where I explored public health concerns within the community. A constant theme in conversation with medical staff and locals was the concern for the obesity rates in the population. Multiple people who I interviewed felt that there was a high number of people in the community living with obesity. One of the major factors that was brought up was the concern about dietary habits. One medical provider even noted the number of fast food restaurants that greatly outweigh the number of grocery stores in the community. I also learned about a food bank that is very well known in the community, Greenhouse Food Bank. They have been working on providing fresh foods for their clients by updating their cold storage area and implementing a grocery rescue program. But during conversation with one of the greenhouse staff, I learned that despite these efforts, the majority of food that clients select at the food bank is non-perishable, calorie-dense items. We discussed how Greenhouse might further their work to encourage better dietary habits with programs like cooking classes. So this idea is what I based my research on, and I ran across a few studies that had explored this exact concept. One study recruited participants that visited local food banks in the Twin Cities to take part in a 6-week cooking class program. These cooking classes involved a chef showing participants how to cook a recipe and followed by eating the meal together. The authors concluded that nutrition education interventions like this can make a difference in dietary habits of food pantry clients. However, this study is limited by its relatively small size and was also confined to the metropolitan area of the Twin Cities, limiting its external validity of the results in the context of other types of communities, such as a rural community like Deer Park. I also came across a systematic review of various types of food pantry interventions. These interventions involved providing information on how to read a nutrition facts label and cooking demonstrations, which were the most common types of interventions studied among the 14 articles in this systematic review. There were also some client choice intervention studies, which entailed multiple steps, like food pantry clients choosing fresh foods based on their own preference, meeting with staff to make and track goals to reach food security, and receiving specific services based on the client's needs, such as cooking advice. This analysis also considered food display interventions, which involved food pantries strategically placing certain food items in specific locations in the pantry or packaging them with or without the original box to influence client choices towards healthier options without a straightforward restriction. This systematic review found that each intervention study saw an improvement in diet, cooking skills, food security, and nutrition knowledge. Now, most of the studies examined in this review used subjective measures to quantify their outcomes, such as interviews or surveys. So this does warrant the need to consider recall bias when examining that data. That being said, there is a program similar to these study interventions that has been successfully established in nearby Spokane at Second Harvest Food Bank, the organization affiliated with Greenhouse. This program entails cooking classes, but it is not easily accessible for Deer Park residents, as it would require transportation into Spokane, which is why a program started by Greenhouse would be fitting for the surrounding rural community. Although Greenhouse does not currently have any nutrition education interventions for their clients in the works, there is potential for future growth based off the level of community support for the organization. Now, in order to host cooking classes or informational sessions, Greenhouse would need a larger facility, and the staff and volunteers at Greenhouse currently work out of a building that was formerly a single-family home, meaning they already have limited space for their current operations. We also have to consider the high turnover rate of personnel, because many people helping to run the food bank are unpaid volunteers. These challenges have to be addressed before a nutrition education intervention can be implemented. But despite these challenges, there is potential for these interventions to take place in the future for Greenhouse and to improve the health of the people of Deer Park. Thank you for your attention and have a wonderful day.